Welcome to World Endoscopy. In this video, we will understand colonoscopy step by step, from patient preparation to scope advancement through the colon. Colonoscopy is performed to evaluate rectal bleeding, chronic diarrhea, anemia, changes in bowel habits, suspected inflammatory bowel disease, and colorectal cancer screening. Before colonoscopy, proper bowel preparation, fasting instructions, informed consent, and patient assessment are essential for a safe and successful procedure. Before the procedure, the endoscopy room must be fully prepared with the colonoscope, monitor system, suction and accessories, specimen containers, and patient monitoring equipment. This is the colonoscope. It is a flexible endoscopic instrument. It is designed to visualize the rectum and colon. It can also visualize the terminal ileum during procedures. The patient is usually placed in the left lateral position, which helps facilitate safe insertion of the colonoscope and improves comfort during the procedure. After lubrication and gentle examination, the colonoscope is carefully introduced through the rectum under direct visualization. Once inside the rectum, the endoscopist begins careful advancement while observing the lumen, maintaining orientation, and minimizing discomfort. The sigmoid colon is often the first challenging segment because of its curves and tendency to form loops during scope advancement. Gentle torque, controlled insufflation, suction, and careful scope manipulation help the endoscopist navigate the sigmoid colon safely. After passing the sigmoid colon, the scope advances into the descending colon, where the lumen usually becomes straighter and easier to follow. At this stage, the colonoscope has passed the rectum and sigmoid colon and is progressing further toward the transverse colon and cecum. Thank you for watching World Endoscopy. If you found this video helpful, please like, subscribe, and share it with your colleagues. Stay connected with World Endoscopy for more professional endoscopy learning videos.